this episode, we're again joined by Jennifer James as she shares the journey of her daughter and childhood cancer. Jennifer will also share about the importance of advocacy and asking questions of the medical community. Thank you for joining us for this episode of Talking Health in the 406, where we're one community under the big sky. I'm your host, Jennifer Van Sickle, longtime healthcare worker turned health educator.
He and Vivian set up camp, and I think they were there for 37 days on the oncology floor.
So your husband and Vivian were there inpatient for a very long time.
Mhm.
And then let's just back up from there. So what happened? She got the stem cell transplant and her cells started rescuing her. Did she start to feel better like immediately, or was it a couple more weeks, or what?
It was pretty
what did
weak.
it look like?
They would let her come like to our condo for an hour or two, and then she'd have to go back to the hospital. They watch you really closely just because you have no immune system. And if something were to happen, you have to be right there. So it took some time. And then after that too, I think it was a few weeks, then she had radiation again. And then after that radiation, I think we stayed a week just to make sure she was feeling good enough to make it home. The hard part though, during that whole time period, is she had met a little friend because she had gone back to school at the hospital and gotten to be really good friends with a little friend from Great Falls. And we'd gotten to know their family. And that little friend then passed away in the amount of time, because we were all hoping to come home together. And the little friend, she didn't have cancer. She had a different condition. But I think if you were to talk to Vivian about that period of time, that was probably the hardest thing, was that she lost her friend during that time. Because, you're meeting people who are going through very similar things. And it's kind of a rough age to learn about loss like that.
Had she even had she was probably 6, I'm guessing at this point in time, maybe?
She was 7.
7?
Yeah.
Okay. Wow.
Yeah.
Wow.
So we came back, and the little girl's name was Daisy. I don't know if her parents or any of her family will listen to this, but we just adored her. And so she came home to Great Falls, and we went to her funeral service, and Vivian came home and started back in school. Not the way we had hoped to come home, but.
Yeah. Wow. And so when Vivian came home and started back in school, at that point, did you guys feel like you were like, okay, we had our stem cell transplant, we've gotten through that, we've made it this far, we're good? Did you feel like, I'm guessing you didn't have the cancer-free clear sticker by any means?
No, we were still on the every 3 months. I think it was, my husband did a Caring Bridge page, which was really nice because we were able to get the message out there for ourselves to the people that loved us. We have a really great support network. And I think I would give that advice to anyone, that we were able to we were just so happy to be home. She was so happy to be home that we just really had to focus on that we were just happy to be home and to have been through that phase of it, and just take it really one day at a time and let everybody else celebrate with us that we were home. I think that we really went into that kind of mode of living, being thankful for each day.
Absolutely. Started back at, I'm guessing, Helena Public School System.
Yeah, we always joked. She goes to a little school here in our neighborhood, and my husband always would laugh that she could smell. Like, we thought we'd come home and it would take we'd give her a week or so, but it was like she could smell the school. She's like, oh no, I'm going to school. But it was always so, even when she started kindergarten, and then when she went back, just was such a huge piece of her sanity, I think, in having it feel normal. I don't know if it was just her little friend group, or the way she handled it, or maybe the parents. Somehow it was just amazing, how supportive and loving all of the other families and kids were. I don't think she ever had anyone question her bald little head, her feeding tube, because that's the other thing too. She had to be on the feeding tube for a while. We weren't able to just, go off that cold turkey. And maybe the kids at that age, it always felt like it was more curiosity. Certainly there were questions, but it was never cruel. It was never a teasing, mean. It was more just a question, and she'd answer the questions, and then they'd move on and go back to playing whatever they were playing. So that was a benefit to her being as young as she was, whereas probably middle school, some of those ages might have been tougher. But the little kids, they're pretty great about it. So,
and academically, had she been able to keep up thanks to the school out at Seattle Children's, and she was in the grade she was supposed to be, and for her age.
Amazingly, I thought we'd come back and need a tutor, but they had, her classes were so small, and they'd have a teacher and then one or two other volunteers there. So she'd go for 2 hours every morning in Seattle. And then she and my husband did a ton of reading together. And like during the time they were inpatient, it was also the Summer Olympics. And so they decided I think a friend had suggested this, but they were going to make a flag, because a lot of the anesthesiologists or the different doctors are from other countries. So everyone they would meet from, they would make that flag then and hang it up on so we tried to come up with as much of those kind of things we could come up with. So no, she amazingly was able to just jump right back in. And the teachers here were great too, just in supporting her. And yeah.
Awesome. And, and it seems like every September when school starts, everybody gets sick. Everybody gets the colds. And you think of schools as lots and lots of germs running around. Did Vivian have to wear a mask? Was there any worry about the sickness from school germs?
No. Well,
No.
Clearly this was pre-COVID, right?
Right.
None of us were masked. I mean, yeah, looking back on it, it's wild to me that because she and I, the second time around, we made a real point to fly home as often as we could. If she would have like a long weekend or a week off of treatment, we decided it would be important to get her back here as much as possible to be with friends and family. And so she and I would fly back and forth a lot, and never once did I put a mask on her. Well, that's the other thing too. We knew her numbers. We knew how, where her immune system was at. And so then we could really gauge when she was more fragile than other times. And so we would make a choice to stay home if we knew like she was at 0. And I can't even remember. At one point I could have told you all those numbers off the top of my head, but maybe that's how we handled it a little bit too, is that because every week they were looking at her numbers to see where she was at.
Then life carried on. You have a 7-year-old in elementary school who is still having to get monitored for recurrence of cancer.
Yeah, every 3 months, and we went about a year, and then she relapsed again. So I know, right? And so this point, we're just like, wow. And the doctors and everybody's pretty stumped because it's the exact same location again, like the surgical site, which is really unusual. Usually it will have metastasized, or
the spot on the other kidney was
never did anything.
Just still. Okay.
Yep. It looked just like a little scar. It didn't even change during. So we let her be at this point now, she's 9. I don't remember exactly how old age is, but she's 4th grade and been through a lot, kind of more life than some adults have been through. Yeah. So we let her be really involved in the decision at this point.
And spent almost half her life fighting it in that battle. Yeah. Okay. Yeah.
Growing up in the hospital is how she would tell you too, is that she spent, the greater portion of her elementary life in and out of the hospital. But we had conversations with her doctors, who at this point have become dear friends, and made an appointment to fly to DC Children's to see Dr. Dome, who's the protocol setting doctor for the US, and decided just to go with a giant surgery and just remove the kidney and remove everything within the vicinity. And so that was a major surgery. And then she said that she would prefer not to have any more chemo and radiation. And after talking to the doctors, we were confident with her decision. And the radiologist even said, we could try again. I have a tool, but, totally appreciate and respect the decision. So had the big surgery done. We were there that took about a month. The recovery was so major, and her stomach just did not want to kick back in. And her poor little body too had just been through, back to the whole zipper thing I told you. We'd been in and out of that scar so many times now. And so after that, she and my husband then went to Washington, DC to see Dr. Dome, just because I wanted her on his radar if we had to, because we were going, traditional forms of treatment were not going to be an option moving forward. And so we needed to understand if there were other options and if she could be part of any of the trials he was running. So,
and had he seen very many kids relapse have this many relapses with?
Well, typically with Wilms, no, there's not many. She's definitely in her own category, and it would have metastasized to the lungs. And hers never did. It just stayed right in that surgical site. And the traditional way of treating Wilms tumor is just to go ahead and remove the kidney. And again, it doesn't help to look back and analyze the decisions that were made. But she's now 15, and knock on wood, has been great. All her checkups, and we're now in the survivorship clinic. So it appears that the major surgery, but now we're in, the other thing I didn't understand about pediatric cancer is that you don't get to just get better, right? Now she has all these chances of other types of cancer because of the treatment. So we have to watch really closely because of her skin. It's as if she's had intense sunburns that nobody would have ever had as a 15-year-old. So we have to watch for skin cancer. She has an endocrinologist because it definitely messed with her hormones. And so we have to really watch that closely. In her heart, the chemo can be really damaging to kids' hearts. And so you have to watch that really closely. And now that she has one kidney, she's, considered a high risk for kidney disease. So there's all these other, and while we choose not to focus on that, I don't want to sound too negative. I'm so thankful that she's well and she's a rock star. And she just you would never know when you meet her. Most people in high school have no idea. So I was even nervous to share her story because I think she really appreciates that she's not the kid with cancer, that she's been able to just be Vivian. And she's very good at articulating the drugs she's allergic to. We now know all her drug allergies and everything that she can and cannot have. And so a journey that she will be on for the rest of her life.
Wow. And so is she having to be on any sort of maintenance medication? I mean, aside from regulating the hormones, any sort of low dose chemo or nothing? Okay.
Nope. She's on no chemo. Nope. She's in all honors advanced placement, which chemo can do some serious damage to your brain development. She had a little bit of hearing loss, but not a lot because they do monitor that as well. And she, not surprisingly, wants to be a pediatric oncologist and use her story and her experiences to help other kids. So I think I'm in awe of her. She has a perspective on life that is so different than most kids her age. And whether I always have felt like she has an old soul wisdom about her, but a lot of it also has to be what she's been through.
Thankfully, you had wonderful friends that let you borrow their condo, let you borrow their house. How did you guys do that all the way out to back and forth to Seattle so much?
It was very one step at a time. I'm an engineer and I was not working full time. So my husband was the primary breadwinner and I was able to focus and, all my efforts were on her. And then we also were fortunate that anytime, because when my son was with us, if I had to end up in the emergency room with Vivian, somebody had to be there to stay with him. So when my husband couldn't be there, because he could kind of work from there occasionally, and then he'd need to be here, my mom would come and she would stay with us as well, because I couldn't be there by myself when they were little. And then when they were older and he could be here, then Vivian and I spent a lot of time there just by ourselves. Trying to think how else it all kind of fell together. We had really great health insurance. That was huge. We really had to fight hard to get some of the insurance, get some of her procedures covered. My husband does government affairs, political work, and he kind of knew how to go about that. And unfortunately, I think a lot of families just think that when something's denied, it's denied, and it doesn't have to be. You can fight those things. And so we fought a lot of that. We spent a lot of time and energy making sure insurance was going to cover as much as possible. And then when we stayed the longer period of time too, Seattle Children's, there was someone, I would love to do this someday. There was a man who had a condo complex and he would let people stay there and you would just pay your utilities. And so it was his child had also been treated there. And so it was his way of giving back to families who were going through something similar. The Ronald McDonald House is a great facility in Seattle, but it had no openings when we went. And to this day, I think there's a huge wait list, and it's something they're trying to work through is how to provide that for families. And then our church, our pastor occasionally, we didn't ever do a GoFundMe or anything, but he would just show up with an envelope with donations people had sent to us. And that we would use that for our airfare. We had friends who would also donate their points or their miles to us so that we could use that for flights. And then we got to know the TSA really well here in Helena as well. And so then when she came home after her stem cell transplant, the TSA at the Helena airport did a welcome home party for her and invited all her friends from school. And there's a video of it out there somewhere. But when I say that we had an amazing support network, I don't even know how to articulate how incredible our support network was. And, we probably don't have the same retirement savings that some people have at this point, but that kind of became the least of our concerns. So,
wow. Yeah. It sounds like a bigger support network than you ever would have realized you had. Like the day before the sledding incident, you probably couldn't have even imagined. I mean, it's amazing how people come out of the
Oh,
woodwork to
well,
help?
I joke about, I had visions of like frozen casseroles showing up on and I kind of like to cook. I was like, please, like, I will give you ideas of how you can help, but please don't start shipping us casseroles or something like that, because people do want to help. Like they want so badly to be able to help and do what they can. So yeah, we were so fortunate to have all the people around us.
Did Seattle Children's have any, I don't know, like a patient advocate that helped you at all, or any?
They
Can you tell
have
us
that
about some of that
available,
too?
and they have social workers. They have a huge, and even financial support. Like if you need, they have a financial assistance, and they have someone who will go to bat for you with insurance companies as well. And then also so they would always also pick us up from the airport. They have like a service with a driver, because we got to know a family from Alaska. And somehow they even had their travel covered. I can't remember how that worked. But yeah, if you asked, there's I can't remember the department within the hospital, but all they do is help families figure this kind of stuff out.
Wow. And
Yeah.
are there any other resources outside of that hospital that you found beneficial, or that you would recommend to any other families that might be going through it?
We maybe received a donation for travel from the St. Peter's Hospital Foundation. I don't know if they still do that. There are a lot of organizations out there, grants, different things you can apply for. The other thing that was fun, and I don't know how active this is anymore, but it was this monkey. So there was a big monkey that would sit in Vivian's stuffed animal that would sit in Vivian's chair at school. And then she had a little monkey that was with her in Seattle. And so then when because we would FaceTime her class. And so Bananas was the name of the monkey. And so he would be sitting in her classroom, and then they would take him on all the field trips. And so then they would like take pictures and send them to Viv so that she got to see, where Bananas had been. And then a different friend would also take him home like on spring break or Easter break, and then send pictures. And, it became a neat way for her to connect. And then she had Junior, was the little one, was what she called him. And so then she would take pictures of him when she was going into different procedures, or we were in the hospital, or we were doing different things in Seattle. And then that's how she would share back to her class. Some of that, while the financial was huge, some of those other things, looking back on it, were almost as important, because it kept her so well connected with her friends and teachers and with home. Because I think for her, the biggest challenge was being away from home. Probably for all of us, being away from home was really hard.
Oh man, I can imagine. So, I mean, that long, and just, especially in a hospital situation, facing some, very, very tough days. Yeah, that's amazing.
And it's so unfamiliar. I can remember one of the first nights we needed a thermometer, because they want you to monitor their temperatures so closely. And so I didn't even know, like, everything is so unfamiliar, right? You don't know where you're driving. You don't know where the gas station, like everything was just you're in this urban, and we're so used to our nice little quiet neighborhood. It was exhausting to have everything be so unfamiliar.
And then, do you have any advice you'd want to give other families that are going through it, or if people get slapped with that scary diagnosis next week?
Think, not to sound too cliche, but there were so many times where I just felt like, I was going to try and predict, but you just have to remain hopeful and just know that you don't know how things are going to end up and what direction things are going to go. And then I've always told the mamas, and I'm sure this goes for the dads as well, but to trust yourself as a mom. Like, there were a lot of times when I would push really hard for something, or like I just would like know something wasn't right, and I had to really learn to trust that. Like, I knew she would get fevers every time she was given vincristine, which is a type of chemo. And we figured out that if she was given fluids, like I started to see this pattern, that if she was given a bag of fluids beforehand, she wouldn't get nearly as sick. And I had to really push for that. But looking back on it, it was so much better for her if we could just give her that bag of fluids. So I had to get over being like that mom, right? And just be like, no, this is what's best for her. And I'm her mom. I know, like, I'm the one who's with her day to day. And there was a doctor who I'm sure is a very brilliant woman. She was part of the stem cell transplant team. And Vivian started running a fever after chemo, which was very routine for her. And she came in and told my husband she was going to do some different, a chest x-ray and a few other things to try and diagnose what was going on. And he said, well, this is chemo, right? She runs a fever after chemo. And the doctor didn't know us at the time. And she was new just because of the stem cell transplant, because it's a different team that does that. And so she didn't really want to be questioned, I don't think. Again, she was probably very bright, but lacking in some social skills. And made a comment that every once in a while there's a parent who thinks their child is really special, and that's more or less a direct quote to what she said to my husband. And I walked in about that point to hear my husband say, okay, have you looked at her chart? I understand that you know how this process works, but do you know my child? Have you taken a real interest in my child? So I think, being willing to, you have to be their advocate, because not that the doctors are going to intentionally, they want what's best for them, but they also don't know them. I mean, she's our child. And so he, I was going to say politely, but he asked, that a different doctor be brought in, that we have someone else working with us on the stem cell transplant. And I think you have to be willing to do those things just so that, they know that you really are paying attention and that are engaged in the process. So I guess I would give that piece of advice. Don't be afraid to ask questions and to be really involved.
And were they accommodating? Did they get a different doctor
on your
case?
And it's a teaching hospital. So everyone was deer in the headlights when I walked in, because they were like, oh my gosh, they just asked for a different doctor. But I mean, you are paying for it and it's a service. I think we start to, I don't know, healthcare has become an interesting thing, I think, in how you have to manage it and be very involved.
Absolutely. From even the mildest anything in your life, whether it's cancer or totally not cancer, a broken toe, yeah.
And I think we should be able to ask questions. And it's not that we're questioning their knowledge or their background. It's just genuinely asking questions, trying to understand. I think if there's any other advice, I often have wished that we lived near because I would love to be there as a support to families so it is such a shocking thing, right at the gates. But yeah. Just hang in there, right? Just one day at a time. Again, I sound like a cliche.
Did you, as you look back and you think about your own, whether it be the thoughts you were thinking or feelings you were feeling, can you see a shift, the very first time, maybe being a deer in the headlights, kind of being reactive, not like doing what you're told, to now you're telling us a story about this other end where you're like, no, this is chemo. We want a different doctor. I mean, can you tell us about like how you were feeling and what you were thinking and going through? It
definitely changes you, because I think that I was probably I don't know, like, I think it definitely has helped me to be more confident, just to trust myself. And I can remember having conversations with her too, when it's interesting the way we would communicate with her too, how we have a lot of hard conversations in our family that I don't know that we would have naturally had. But even when I knew a doctor was coming in and we were going to have a hard conversation because labs got lost or whatever had happened, and I would say, okay, this is what's going to happen. This isn't about you. I just have to ask some hard questions, so that she would be okay with that tension too, because when you're already not feeling good and then having to sit through confrontation like that, I think, I don't know, it's just balancing a lot of different things. I used to worry too, when she was real little, that she was just a sweet, like, I was worried she was going to become too accommodating, and she definitely has her own voice as well. So I see that she kind of learned to also, in a respectful way, ask questions too.
Yeah. She's learned that advocacy. And yeah, interesting. I think, when she's accomplished her goals, and she's that pediatric oncologist, I bet you won't have the same issues with her with social skills that you will with that you've had with others. And
the other fun thing is that they, as a teaching hospital, you had to get used to the fact that 6 or 8 people would walk in at once. It wasn't like just one doctor, and I wasn't used to that. So all of a sudden, but then they would always be talking right to her. So her like comfort level with adults and with like sophisticated conversations and really analytical, been fun to see how and it catches people off guard, I think, because I don't know how else, it's almost like she's had her own little mini medical degree through this whole process. So that's been kind of a funny thing to watch her grow into.
That's a good way to put it. That's a really good way to actually, she probably has. You can probably toss some big words at her and she'll know exactly what you're talking about.
Oh yeah. And she'll spring them on her teachers, and her teachers will be like, wait a minute. How do you know this? So
we pulled some interesting data on nephroblastoma or Wilms tumor. And so in the past 20 years, there's been 41 cases diagnosed in the state of Montana. All of those are in kiddos under the age of 9.
Mhm.
And only 6 out of the 41 passed away from their cancer. So we average about 2 per year. Have you guys ever crossed paths with anybody else that's had the Wilms tumor in Montana at all?
We've traded notes. I've had a couple of families reach out to us. And actually there is a family I'm from Central Montana originally, and there is a family and their daughter is my age. So I can remember the treatment was very different. So yeah, we have with a couple and we've traded notes with a couple, but you said in the last 40 years, only 41 cases?
In the last 20 years, there's been 41 cases, okay, all so under the age of 9. Yeah.
And it is typically, Vivian was even on the high end at 5. Typically they see it in like 3 and under. Like it's definitely a young child.
It's the most common type of kidney cancer in children.
Mm-hmm.
9 out of 10, it will be this type of cancer. And 9 out of 10 are usually cured.
The other thing, I think when I was visiting with Vivian this morning, those numbers tell you how rare it is in Montana. And so that was another big reason for us to go to Seattle, was to be with doctors who saw this a lot, because they knew the treatment plan, they knew what to look for. Because I think, for maybe, we didn't look at it for too long, but of course you go through that analysis in your head of, should we just stay here and do treatment? Should we go somewhere? And for me, that was the biggest reason to go, was to be in a place where that's all they did. They weren't also trying to, like, her doctor treated neuroblastoma, I think, 2 types of solid tumors, and that's all he treats. And her nurse practitioners were the same way. So it wasn't like they were treating other types of childhood cancer. They weren't treating leukemia. They had other doctors for that, much less trying to treat adult cancers. So for me, that was the biggest selling point, to get to a place that really, that was all they did, was they really focused on what she was battling.
That's a really good point. My mind conjured up the jack of all trades, master of none, saying. Not
to downplay any of our doctors in Montana, but it's pretty hard to know about all the different types of adult and pediatric. There's just so many different types.
Too, you think about with some, maybe not necessarily this one, but the equipment that might be available, the technology, the medications, the stem cell transplant. I mean,
well, and the pediatric ICU, if you were to crash, I don't know, you could probably tell me, is Billings?
I don't know. I know Kalispell has one, up at Logan's Children, I believe, but, exactly. It takes us 4 hours to get from Helena to Kalispell. So you're already on the road anyway. Mm-hmm. So, or 3.5 hours. I'm curious. So like some of the signs and symptoms, according to Google, when I looked up this, talked about, fever, abdominal pain, constipation, high blood pressure, swollen veins in the abdomen. When you look back and you think about life with Vivian before the sledding incident, can you think of anything where you're like, ooh, might have been a sign we saw, or something that I just blew off, like anything like that? Nothing.
Not a one. Yeah. No, there is nothing that would have told us if she hadn't had that accident. I don't know. Like, I think the few families I have talked to, like, they notice like a distended abdomen. Like that's the only, and I didn't see that in Vivian. Always real petite, trim, she was thin enough that if it were, we would have been able to see it. So, regardless of what you think about a higher power, I don't know. For me, I definitely think the sledding accident happened for a reason.
And, I spent a lot of years in healthcare, and a lot of diagnoses come that way, where it's just uncanny. You go in for one thing and they find something else. You go in because you broke a rib and they do an x-ray and they catch a growth somewhere else, or a CT. It's amazing. Or the doc happens to run blood work on a kiddo and the blood work shows something is horribly wrong. It's not just the flu.
Pretty interesting. Yeah. So, and our son likes to take credit because he was on the sled going down the hill when she dove on. So we let him think that he had some sort of, hand in all of this.
Perfect.
Yes, he had to put up with the roller coaster this whole time too.
Oh man,
that's the other thing that I think people, it's not like, we all went through it. And there were a lot of times I almost worried more about him than her because, everything was so focused in like all of the the different therapists and the treatment and the school, and everything was so focused on her that sometimes I was like, oh, but nobody ever asks how he is. Everybody always asks how she is.
And how did he do? I mean, did you feel like he acted out or anything like that to get attention, or
he did pretty good. I think maybe some of that's yet to be seen, to be honest with you. The number of, because I have been to some pretty fabulous therapists to help me get through all of it. And some of the advice they've given is that some of this bubbles up in their teenage years, and I wonder if that's true with a lot of childhood trauma, that you kind of start to process it more in your teenage years. I don't know that for sure, but I think, we have tried really hard to let him have his own interests and let him, be his own person. And as much as we've tried not to make this her story, we've certainly tried not to make it his as well. And also, I think my husband always would say too, we're not going to let this be an excuse, right? We're not going to excuse behavior, excuse certain things. So I don't know. That's a long-winded way to say he seems to be great, but I guess there's a part of me with both of them that still kind of thinks, it'll be something I think they'll be processing and trying to understand for probably most of their life.
They talk about the ACEs, the adverse childhood experience. Yeah. And oh man, unfortunately those boxes were probably definitely checked big time, but yeah. And you just never know, I know I've heard about, they call them, the orchid versus the dandelion, how, some people are extremely resilient. They're dandelions. They grow and they thrive no matter how many aces you throw at them. And then you have your orchids that don't, and we're all our own individuals. And that's interesting.
I'm sure it will influence. I mean, it certainly influenced the choices she's making. And I'm sure on some level it will his as well, right? It just affects what life looks like. But the other neat thing that it was through the Fred Hutch, which people who have been out to Seattle for healthcare, it's another like cancer treatment or organization, but they offered a summer camp for siblings. And so he was one of the youngest ones there, but it was super fun. And he would go, I think it was pretty much all day. And we met this other family who had moved to Seattle from Hawaii. And it was an older sister. Their littlest brother was the one in treatment, but there were a couple other brothers in the mix. So she kind of just, at the time, I think she was maybe, I don't know, 4th or 5th grade, but she kind of just took our little guy under her wing with her other brothers. And we became really good friends with that family. And so, the resources for families was just that was just incredible how many things are in place. And I think probably Denver Children's, like probably most children's hospitals have those things. So that was pretty great that he was able to go be part of something like that and be around other kids that, their siblings were going through the same thing.
Oh, that's amazing. That is very cool. Mom and dad are probably like, can we get a parents camp, please, too?
Oh, well, that's just it, to be able to be around people. Well, even the other families we met, like that's been great because nobody else can really understand until you've been through it. So, and maybe that's been when you asked if I have changed. That's probably the biggest way I've changed is that realizing that there's only so much I can control. And it's just to really be content and grateful for today and what we have today. It's been not that I would wish this on anyone else, but that's been a huge gift to be able to live like that versus always thinking that if I buy this, or if we go do this, or if we accomplish this, like all of that has gone away for us, that none of that is important. Yeah, that's been a gift.
Yeah, definitely. You guys have an awesome perspective for sure.
I tried on anger for a while. I've told people this before, you can decide to really be mad about it. And that didn't feel great, right? That didn't work well. So I think we've just tried to find the silver lining. And I think for her to be able to watch her in the way she will be able to help other kids is just so amazing. And I can't wait to watch that happen because I just know she'll be so amazing at it.
Thank you so much to Jennifer and also to her daughter Vivian for sharing their story with us. If you would like more information on childhood cancer or anything else you heard in today's podcast, visit our website at talkinghealthinthe406.mt.gov. And if you haven't already, please go ahead and click on that subscribe button wherever you listen to podcasts. We would greatly appreciate it. And until next time, take care.